Hi again, Dr. Lee Coleman, Psychiatry and Society, and I'm very pleased to have you here. We're going to keep going with another aspect of our system of protecting children from child sexual abuse, investigating whether or not such a thing has happened, and responding to that problem, which we all want to see children protected, of course, from all kinds of abuse, and we know that they do get abused. Any group in society that is not able or less able to protect itself will be abused. We can never do away with those things completely, but we must do the best job we can. And I've had a lot of experience and come to the opinion that we have a terrible system by which we don't know how to tell whether children are being abused or not because of the mistakes that the system is making. And I want to talk about another aspect of that. You know, I led into this by talking about the battered child syndrome, the recognition that of physical abuse or neglect of a child, non-accidental injuries or deliberate trauma. And in that, and the fact that I happen to be trained where that first was put on the map by Dr. Henry Kemp and Dr. Brant Steele, departments of pediatrics and psychiatry, respectively. So that field, although it does have some problems of abuse there as well, but we're not going to get into that in this series, but it's much more scientific because it's part of medicine, pediatrics, physical trauma. There can be evidence of fractures, bleeding, things which, if it's properly evaluated, will demonstrate or not whether there was some reason for these medical injuries that would possibly be criminal. And then we have a criminal justice system for that. But in the area that we're focusing on, sexual abuse of children, you would not necessarily expect, and in fact most often will not have, any physical signs that would corroborate or indicate that there was sexual abuse, even if in a particular case it was happening. So let me just say this kind of situations where you wouldn't have any physical signs, and that should not be taken as evidence against it happening. It would just simply be that there's no evidence for it. First of all, if a child is not examined in the immediate few days or weeks after sexual abuse, you could have had some kind of physical sign of it, but it would now not be present any longer. You might have some sort of tearing or bleeding, which would have healed, or bruising. But say a month later, there's good evidence that injuries that are of a certain nature, not overwhelming injuries, but still significant, would have healed up. So unless there was a report done fairly promptly and an examination, you would not expect there to be a sign of injury. So what that meant is that the people who were initiating this new movement, we've been talking about the people who were doing the interviews, the police departments, the social workers, people like Key McFarland who were claiming to be specialists in how to interview children, and people who were getting trained by people like that to do what they did. Those and the attorneys who were involved in it, who wanted to work in law enforcement, in the legal system, prosecutors, in confronting how to do it, they had an extra problem. That is, it would be easier to demonstrate that something had happened if there were physical examination findings which were helpful to a judge or a jury, or an attorney trying to understand what the truth was and work with the client. If it's a prosecutor, to see what was evidence that could be presented in the case. So what happened is most unfortunate And I want to explain it to you by starting off with a specific example. I remember the day about 30 years ago where I went to a meeting at the Children's Hospital in Oakland, California, one of the major pediatric facilities in the San Francisco Bay Area, because I had already started working in the kind of sexual abuse allegations that we've been talking about. I'd already seen the pattern that we've been talking about, the one-sided investigations, the way that people were being trained to assume that a child was molested, and then not truly investigate because they thought they already knew the truth. We've already been going over all that. And now there was going to be a presentation by an attorney to the medical staff of Children's Hospital about physical examination of sexually abused children. Now, the way I just said it was deliberate on my part. I said physical examination of sexually abused children. But in fact, that really wasn't the topic. The topic was physical examination of possibly sexually abused children. That is, children where there's been an accusation, but there's been no legal finding that such a thing has happened. And in fact, the prosecutor, I went to the meeting, and what I heard confirmed the things that I had already been learning from study prior to this. Because basically what the prosecutor came and talked and said to the doctors and the nurses was, you know, it would really help us in our prosecutions to successfully prosecute child molesters if you are receptive to the fact that children do get molested. And when you examine children, you do anal and genital examinations and total body examinations, that you don't close your mind off to this topic and you don't get scared off, and you're willing to do these examinations, and you recognize that the signs may be there, but you just need to look for them. And he then went on to summarize the fact that there were findings that general pediatricians were not recognizing. So at that point, he then moved into what I had already become familiar with through study of particular cases and reading of medical articles, coupled with my medical training of what doctors do when they examine patients and children. And I certainly, in my training, had examined many children, especially as an intern in pediatrics. So I knew that there was one doctor in particular, and a few others following his lead, who were making claims about subtle signs of sexual abuse that could be noted on a pediatric exam of a child, usually a girl, but not necessarily, but usually girls. And this was Dr. Bruce Woodling, who is not and was not a pediatrician. He was a family physician, no specialty training in pediatrics, but nonetheless was closely collaborating with the prosecutors in Ventura County, California, and making a lot of claims about what he was calling microtrauma. That is, things which would, according to generally accepted pediatrics, would not be taken to be a sign of anything, but were being claimed by Dr. Woodling to be signs of sexual abuse. For example, things like a little pattern of blood vessels where you could actually see little, what we might call an angioma in medicine, where the fine blood vessels actually have a little more blood running through them for a small little area, hemangioma or angioma. It's an insignificant finding unless there's something else combined that might be significant, but he was doing things like making claims for what the shape of a little girl's hymen should be. The hymen is the tissue that sits at the opening to the vagina. It's irregular. The contours of it are irregular. because in fetal development, for a good portion of it, the little fetus does not actually have an opening. The hymen is a closed curtain between the outside and the inside. The child is not urinating, of course, in utero, so there's no reason that there needs to be an opening. There's nothing coming out, like, of course, when the girl much later is menstruating. So the hymen is a structure which develops in fetal development such that openings start being created. And in all but 1 or 2 per thousand, by the time the little girl is born, there is an opening between the outside and the vaginal canal. The shape of those openings and the shape of the hymen is very variable. It's not like every little newborn girl, or by the she gets older. It's not going to be the same in everybody, just like noses and chins and fingers. We all have a range of normal anatomy. But Dr. Woodling had written an article in which he made a claim about all these subtle things which he was calling microtrauma. And of course, he had no evidence for it. What he was saying was, in the examinations that I see of sexually abused children, this is what they show. Now, you listeners, have you gotten your smarts together enough from my previous talks that you know what kind of question to ask at this point in the talk? Well, I don't necessarily think you will know, because after all, I'm throwing this new subject to you, but it's really, here's the answer. And if you think back of what I've been saying, you'll see. What you should be saying is, well, does Dr. Woodling have a way of knowing which of the children that he has examined have been molested and which ones have not been molested? And if he doesn't have a way of knowing which ones have and which ones haven't, how in the world can he attribute these various signs of alleged microtrauma, like the shape of the hymen, or whether there's a little pattern of blood vessel somewhere? How can he say those are signs of trauma when those could be children where there wasn't any abuse? There might have been an accusation. So he cannot do the most basic thing that a real scientist would do, which is have a control population and a group which is is different in one way. Dr. Woodling made no claim that he had ever done any research, and in subsequent study of his work, I've never seen any research. He's never held himself out as a researcher. But nonetheless, Dr. Woodling became the source for a growing group of pediatricians and interested nurses who wanted to be part of newly developing sexual abuse examination teams. So what happened was, year by year, starting in the late 70s and early 80s, each county began to develop a team. They called it vertical prosecution, meaning that you had a team of people who worked together and kept from the early stages all the way through to a trial, all the way from the initial interview with a child, or at least initial as far as being taped, all the way to presenting an expert witness in a trial. They were all collaborating with each other, and so you now had the development of a sexual abuse examining team, so that if an allegation was made and a child was being sent for examination, it wasn't a kind of a independent examiner, someone qualified in pediatrics, but somebody who was hopefully not going to assume anything about what the truth was. It were examiners who were already on board the attitude that if you're sending me the child for possible sexual abuse, then I think they were sexually abused. And they then began to report findings right and left that would assist gaining a guilty verdict in a trial. I've had the opportunity to study hundreds and hundreds of those examinations, adding up to thousands of pages, thousands of photographs. And what happened is, for a decade or so, nobody had done any research of the most basic sort to test out, what does it look like if you examine children who haven't been abused? Are these subtle little findings meaningful? And when they finally began to do the research, they found that all the things that Woodling had been advocating, and then more and more independent people had been advocating, were simply things that could be found in any child. They were not indicators of abuse, but to this day, we still have evidence coming into trials claiming that these are signs of abuse. We even have the protocols written in such a way as to confuse and fool people into not understanding what's being said. And let me finish up this session by just telling you what that is. In medicine, there's two very important things that doctors typically do. They take a history, and then they do a physical examination, and maybe laboratory tests if there are any. And then they report all that. They actually got together, these sex abuse examining teams, and they wrote up a protocol, which then became the official state protocol, in my case, California. I'm pretty sure all the other states do something similar. If a child was brought in and a parent and or the child make a claim about something happens, the pediatric or the nurse examiner will write down what is being told to them, and without any independent investigation, that medical examiner will write history of sexual abuse. Now, in medicine, real, genuine medicine, the term history are things you hear from the patient which you take at face value. You don't independently investigate that in most cases. You don't have a way of getting the records, and there's no reason to doubt what the person tells you. You accept it. So they write down history of sexual abuse. Then they do the physical exam, and if they followed these guidelines that have been followed by so many, started by Woodling, but many others coming along and echoing or mirroring the same thing, shape of the hymen means, or this various little microtrauma, they will say physical findings consistent with sexual abuse. Or they will say normal physical exam that's consistent with sexual abuse. Because as I told you at the beginning, a normal exam is consistent with sexual abuse. Just like Andy's semi-bald head over there across the room from this taping is consistent with bank robbery. There have been a lot of bank robbers who had the kind of hairline that he has. And I would fit in there too, even worse. So to say that a normal physical exam is consistent with sexual abuse is a meaningless statement in terms of whether sexual abuse is taking place. But it's a very meaningful statement as far as the examiner who would write down such a thing. It means that that examiner has unthinkingly accepted and supporting a policy which would help to convict people of something whether or not they've done it. And that, ladies and gentlemen, is exactly what is going on across this country, and now it's going to be going on more and more across the world. So the prosecutors now regularly use fake medical evidence in addition to fake interview evidence. It's a terribly disordered system. You cannot protect children by promoting injustice. We don't need it. What protects children is the truth. The truth is what will protect children when they have been abused, and the truth is what will protect people who get accused who are innocent from the injustice of false convictions, and will at the same time protect children who have not been abused but get caught up in the network of adults who so desperately have this opinion that they're willing to get to do things which are ill-advised. Family members who get caught up in their own opinions and feelings about somebody. Next time, we're going to talk about other aspects that involve adults having memories created about things that are not real and accusing other adults, the so-called recovered memory. That's going to be the subject next time. So come back. We will keep going. This is a big topic, and we're not quite done. Thank you very much once again.